Today's demonstration is energy infused neck massage. We begin the massage by setting your intention, and beginning with an effleurage, you will stroke from the sternum out to the shoulders and up the neck, and stopping at the base of the skull. When you stop at the base of the skull, be careful not to be using the pointed end of your fingers, but more the pads of your fingers. And here I'm just doing some cross fiber friction, going downwards and then kind of doing some circular motions and then back outwards and up the neck and back to the occiput or the base of the skull. I'm kind of feeling the tissue here, noticing some restriction on the right side. You'll notice the redness in his skin here. That's called hyperemia. We're just promoting blood circulation, so it's kind of showing on the surface of the skin there. Now I'm going to have him rotate his head to the right, being gentle when we rotate. Notice this section here, there's veins and nerves, so be very careful here. I'm using just a soft pressure. And again, going to the base of the skull there. This is where we have the attachment for sternocleidomastoid. So I'm just working down the muscle here, being careful of that artery and any nerve that's traveling through this section. And then we're just going to stroke all the way through down to the shoulder, over the anterior deltoid, medial deltoid, and as we're coming up, it's the trapezius. Now you're going to see I'm using my thumb to kind of pinpoint some work here on the anterior deltoid. Be careful here, check with your client, make sure the pressure is okay. I like to use a pain scale 1 to 10, 5 being moderate pain, 10 being extreme pain, so we want to make sure that we're at a comfortable pressure level for the client, so 5 to 7. The intention here is to make sure that we're not pushing so hard that the muscle reacts and causes more tension in the muscle, so just check with your client. And here again, I'm doing some pointed work on the occiput. Now you'll notice some sophist on the trapezius, going outwards. And really feel for the tissue here. Notice that I'm not using my knuckles, but kind of that flat surface of my fist there. Now I'm just kind of gently stroking across the fibers against the attachment point of the trapezius, moving backwards or downwards. And now I'm just holding the trapezius. You can hold that spot just to kind of get some flexibility in the muscle, promoting blood circulation again. And again, I'm looking for any sort of nodules that might be in this area. And if you find one, you can pin it down like I am here. Notice my thumbs. Right there. I'm keeping that thumb nice and straight, making sure not to overextend it. And I use a light amount of lotion. We want to get a good amount of friction in there, not so much of a glide. Unless you're aiming for more of a Swedish style massage, then I would use more lotion, something with a lot of glide. And since I'm at home here, I'm using just a basic lotion that you can get at any pharmaceutical store or even a grocery store, Target, things like that. So this is And then I had him rotate his head to the left. Jorge has a limited range of motion on the left side. He's been recovering from a cervical nerve impingement. And so I'm just making sure to be gentle. That's another thing to consider when you're working on your clients or on your loved ones, that you just be mindful of anything that's going on in their health history. If there has been any nerve problems, there can be a higher sensitivity to touch, which might equal out to more pain. So always check with your client. Jorge is wearing the Aftershocks bone conduction headphones here. He's listening to binaural beat frequencies. Binaural therapy or binaural beat frequency is a type of therapy that sends a pulse through the headphones that resonates with the brain, allowing him to feel more relaxed and in a deeper state of meditation, depending on the frequency. And there I go doing soft fists again. Notice that my other hand is gently placed against his head, just making sure not to push too far into that range of motion. Again, because of his recent injury to the nerve, we just want to make sure to gently support that side of the head. Okay, now I'm bringing the head to the center. Grabbing a little bit more lotion, doing a nice effleurage, starting from the sternum to the shoulders, around the trapezius and up the neck, and to the base of the skull. Getting into the scalings here. You'll notice how I swept upwards. Think about the neck muscles and how they attach to the clavicle. And again, pinning the trapezius on both sides now. With Jorge, you can really see where the veins travel through on his neck, so that makes it a lot easier. If you're not able to see those veins, just be mindful of it and just try not to hang out on those areas for very long. If your client begins to feel any sort of numbness or tingling, certainly tell them to let you know of anything like that. It's very important to keep an open communication. And pushing down on his shoulders to kind of get that stretch in the trapezius and sweeping back upwards. Placing the pads of my fingers under the occiput, that always feels really good. So now I'm just going to do a nice face massage here, working on the brow. Really thinking about opening up that third eye. So you're going to see me split that line there. I'm doing some pointed work and pulling the muscles outwards. These muscles work really hard. They're always helping with any sort of expression of emotion. So if you're thinking, you're skeptical, angry, sad, sometimes we furrow our brow. So these muscles do get kind of tight here. Now I'm doing some pointed work. And just sweeping across the eyebrows. Gently. Be mindful not to pull on the hairs too much. Going around the eyes onto the bones, the cheekbone structure here. My thumbs are overlapped here. This hand positioning helps to keep that pressure consistent. Going around the cheekbones, around the eyes. And I'm just grabbing a little bit more lotion for glide across the chin. And you can massage the chin here too. Just some circular motions feels nice. If your partner has a beard, just be gentle. Now we're just working into the jaw. We have muscles here too, so we gotta soften those up. This is just a light pressure, probably around a 3. Then we're just gonna do some circular motions around the temple, which is really good if you're having headaches. Don't forget to remind your client to take some nice deep breaths. Now I'm just dragging my hands across the hair here, along the hairline. This feels really good. Pulls on the hair just slightly. And then I'm going to do some pointed work. Again, in this moment, I'm thinking about the crown chakra. Allowing for energy to flow from the crown down into the third eye. And even though we're not working on the rest of the body, energy will find where it needs to be, healing wise. So this energy will travel all the way down to the root chakra, which essentially means all the way down to the feet. And where healing is needed, it will go. Then I'm just creating some energy friction here in my hands. Working with the aura. Think of your hands like batteries. The right hand is the positive energy. Left hand is negative energy. Neither are good or bad. We simply want to make sure that we're keeping that conduit of energy transferring. Energy infused massage is really beneficial in promoting healing. This very calming technique activates the parasympathetic nervous system, which promotes healing throughout the body. It's the natural healing centers within the body. So whenever we get a cut, for example, it is our autonomic nervous system that goes to work. and communicates to our body to send white blood cells to that area. And so by doing just a nice relaxing energy work, we activate these centers and allow the brain to do the work that it is good at, which is self-healing. I'm doing some pointed work on the trapezius here, bringing an attention to the areas of concern. And just making sure to cover Jorge back up. Do some final touches here, putting some pressure on the shoulders so that we can open up the pectoralis muscles. And I'm just going to use the base of my hand to push down onto the pectoralis muscles and some soft fists, nice and gentle. And that completes our session today. Thanks for watching.